So welcome to the Fabulous Fit and Fearless After 50 Summit. I'm Jennifer Patrick, and today I have with me Dr. Iris Crawford. She's a naturopathic physician who helps busy, burned out women nationwide reclaim their health so that they can tackle anything life throws at them. And I think that sounds fantastic, the burnout part, because at this age, I'm 51, I've got a 9-year-old. I work full time for the health service, and then I do my other job on the side. You're always struggling with burnout. So I look really forward to talking to you. But let me tell you a little bit more about Iris. She's the founder and CEO of Natura Cure. Is that how you pronounce it?
Nature Cure.
Nature Cure Wellness, creator of the Empowered Women's Health Project, author of several books, and a leader in the field of women's hormonal health. She received her Doctor of Naturopathic Medicine degree from the National University of National Medicine in Portland, Oregon, and a Bachelor of Science in Natural Health Sciences from Bastyr University in Kenmore, Washington. She's a member of the American Association of Naturopathic Physicians. And today we're going to be talking about the most overlooked hormonal issue causing women fatigue, and it's not your thyroid. So, she's not told me what that is yet, and I'm really excited to hear what it is. So welcome. It's nice to have you.
Thank you so much. Thanks. It's really great to be here and be chatting with you today.
Yeah,
I'm really passionate about helping women with fatigue and low energy, and I feel that we could do a lot more in the world if we weren't struggling with this. So that's my mission.
Fantastic. And what is this hormonal issue that women struggle with?
So there is this major fatigue trigger. It's unique to a woman's biology. And although thyroid health is a very underdiagnosed and kind of missed health problem that a lot of women are dealing with, there's another issue that actually is even more important than thyroid health, because it actually impacts your thyroid health as well. And it's your adrenal stress response. And the thing that I really that my message is with this is that there's this very specific, unique hormone imbalance that our adrenal stress response causes. So adrenal fatigue is something that maybe some of us have heard about, right?
Mm-hmm.
But the thing is that it's not recognized in conventional medicine at all as a real thing. So what happens is women have just, daily stress, right? Can be a pandemic or, deadlines or job situation or having kids, all these things. We kind of have the weight of the world on our shoulders. We're the caretakers and all of that. And that stress causes adrenal dysfunction, which goes hand in hand and leads to a hormone imbalance. So the thing that I really like to highlight is the fact that this hormonal imbalance is actually unique to women, because what happens is, in response to stress, we produce a bunch of cortisol, and cortisol protects us and helps us to combat stress. But over time, our adrenals fatigue and we can't make that cortisol in the same amounts as we could before. So we can become cortisol deficient at some point, which really does cause to a lot of fatigue that is totally not addressed in conventional kind of health situations. But what happens that is really unique to women's health is cortisol and one of the main female hormones, progesterone, are on the same production pathway. Okay. So when we have stress, our bodies are triggered to produce only cortisol, not progesterone. Can't make both of those hormones at the same time. So it's I think an epidemic of women having hormonal imbalance that is basically a progesterone deficiency. So when
So
you're,
it's high cortisol, low progesterone.
yes, and
Yes.
over time, your cortisol actually can go down to be normal and then deficient. So it depends on how long you've been dealing with stress, because your adrenals can only put out that much cortisol for so long before becoming fatigued. So it goes high cortisol, and that's when it starts to steal your body's ability to make progesterone. And there's actually a term for this. It's called pregnenolone steal,
Oh, yeah, I've
and
heard
it
of
robs
that.
your body's ability to make progesterone. When you become progesterone deficient, you become estrogen dominant, because your estrogen might be normal at this point, but your progesterone's low. And that ratio is so important for all kinds of, well-being, sense of well-being, like your ability to fall asleep and stay asleep, your ability to handle stress, your ability to, for women who are suffering with anxiety, there's a direct link between your progesterone levels and anxiety. And then there's over time, with this whole adrenal fatigue situation, there's a direct link with your estrogen levels and mood. So like depression. So all those mood issues, low energy, all these things that women, they'll go to their doctors and say, there's something not right. I don't know what it is. Even they might say, could it be my hormones? And then the real clincher is maybe their doctor will test their hormones and they all come back normal. And that's because they're not testing the right things and in the right way to identify these issues. And so women are turned away, and they're having a hard time getting the help that they need with this. So that's kind of the main. So it's not just adrenal fatigue, it's adrenal fatigue and the hormone imbalance that it causes.
Okay, let me ask you something. As a naturopathic physician, are you against HRT? Because obviously, if you were doing combined HRT, you would get progesterone in the second half of your cycle. Like I've just started HRT myself, and I'm still on the estrogen. This is my fourth week of my second week of estrogen. Then I go to 2 weeks of progesterone. So if that's the case, that your progesterone is out of whatever, could that help you feel better once you move to that progesterone?
Yes. So the answer is I am not against HRT. I'm not a big proponent of synthetic HRT. I provide my clients with options for bioidentical HRT, so BHRT.
Okay.
And what that means is these are hormones that are naturally, like they mimic hormones that are naturally present in the body. So they're more molecularly, they're more structured to the hormones that are in your body. They're much safer. I'm also not a fan of BHRT or HRT as a long-term solution, because I believe that when your body is supported in the right way, that you should be able to make your hormones in the right balance for your age.
Okay.
And this is, like I said, this is the biggest thing that I think is missed in women's health, is that yes, for temporary relief of symptoms, I do recommend BHRT in many circumstances, while we're working on the long-term, underlying cause as to why their hormones are low or out of balance to each other, right? So because otherwise, what are you're going to have to use HRT or BHRT long term, or forever, unless because if you stop at someday you maybe want to get off of that.
But then you lose your brain health, your bone health, and and that is worrying, and it's something I think of. But at the same time, the risk, like the breast cancer risk, breast cancer is 90% curable. Osteoporosis, heart disease, and what's the other thing? Dementia. They're not. So I would rather risk breast cancer than. But I love the fact that you have a natural progesterone. Is that made from yams? Is that?
It is made from plant material, and it's so it's isolated in a lab, and then so they derive it from plant materials. So I'm not sure exactly which plants.
Okay.
And then they produce it as a bioidentical progesterone. And there have been studies on the fact that synthetic progesterone, progestin and those things that are in HRT and birth control pills, that those actually do increase your risk of breast cancer. However, bioidentical progesterone decreases your risk of breast cancer. So it's pretty profound, the difference of using a bioidentical type product and a synthetic product, medication. So I do highly recommend, especially if you have breast cancer in your family or anything like that. And then the other thing of not doing anything at all also increases your risk potentially of breast cancer, only because breast cancer and any other estrogen sensitive cancer, when you're progesterone deficient, which I would challenge us all to think most women are, because that biology, we can't stop that unless we're using specific things to support our stress adaptation response, that stress, brain body stress axis. And so if you're not supporting that, then your body it can't help but reduce its progesterone output because it's making cortisol instead to protect you from the effects of stress. So estrogen dominance also predisposes you to an increased risk of breast cancer. So using bioidentical progesterone to balance the ratio of progesterone to estrogen is actually better than doing nothing at all even. But again, my approach is I do believe your body can make progesterone in the right ratio to estrogen if that stress response system is supported.
Okay. And can you support that with other things other than BHRT?
Yes.
Okay.
Yes.
Okay.
BHRT does not, it may correct that ratio, but it does not address the root cause.
Okay. Okay.
Yeah.
And like, if people were interested in BHRT and getting a prescription for that, I think there's a few prescribers in the UK, but you're in the USA. Is that something where they could get an appointment with you and you would be able to write the prescription? Is that how that works?
So I actually don't need to write prescriptions for it because I don't use prescription HRT. I make recommendations for bioidentical products, which are actually over-the-counter type products. The real key is the right testing, because just taking a bioidentical progesterone, that could be helpful, but you're still not addressing that underlying cause. So I do specific types of testing that I can identify the root cause. So in other words, how your stress response system is responding to stress, what stage of adrenal fatigue that you might be in, and where all of your hormones are and what your progesterone to estrogen ratio is. So that's really the key, because you want to address this in a whole person perspective. It's not just about the hormones. It's really looking at a whole person perspective as to how your body is responding to stress.
Okay, so that would involve blood test, right?
Actually, it's not a blood test. And the reason why I don't use blood tests is because blood testing for hormones is only testing bound hormones that are bound in blood, not free hormones that are in your system. So saliva or urinary hormone testing is the best. It's the most accurate, because if you think about, like, this is my analogy that I use, is if you think about like a closed jar of that's half full of water, and you want to measure how much oxygen is in that jar, you would, if you just test the water, the H2O, you're going to get the oxygen that's just in the water, but not the oxygen that's in the air. And so salivary or urinary hormone testing is actually testing the whole body amount of hormones. If you rely only on blood, you're going to miss perhaps years of being deficient in a certain hormone until it's also low in blood.
Okay. And would that test testosterone in a female as well? And do you have a natural type testosterone you would prescribe?
So usually I address, so because adrenal fatigue actually causes all of the hormones to be low if left long enough and untreated,
Mhm.
I'll treat the adrenal stress response. I'll also help. I have an herb that I use specifically, or mostly one herb, but there's a combination of herbs that you can do that specifically address testosterone. And I've almost always been able to raise a woman's testosterone without having to give her testosterone. Testosterone is a prescription only thing, and I'm not prescribing anything for women at this point. And so I've for years I've been able to help raise women's testosterone levels without prescription testosterone, so I have no issue with it.
Okay. Um, what are some other lifestyle things we can do to help our adrenals? Or
Well,
are there?
you hear about stress management.
Mhm.
And I think that, there are things that you can do for stress management, of course. But I think stress management, in addition to herbal type approaches, nutritional type approaches, are the perfect thing to work together in concert to address a healthy stress response system. So stress management, of course, there's things like yoga and meditation and saying no, or, going on walks, exercising, all those types of wonderful things, getting good sleep, good nutrition. Those are all very important. But I do think that alone does not resolve this issue. Not if you want to have a lot more energy, and if you're really struggling with low energy or insomnia or anxiety, depression, even weight gain, no matter what you eat or how much you exercise, low libido, brain fog. These are all like the things that women struggle with so much, and they don't get help with these things. They're mostly just prescribed either birth control pills or antidepressants.
Okay. And what you can do is talk to the women, do these tests, these saliva tests and urine test, and then come out with what you feel they need based on the test results. Yeah.
Right. So, and I do a long-term plan with stepped phases. So it's a 3-step kind of plan. It's a comprehensive plan based on their entire adrenal health. And I provide a whole plan that addresses hormones, adrenal function, nutrition, things like that. And it doesn't happen overnight. It does take, so I do at-home salivary test. It tests AM and PM cortisol and melatonin, as well as progesterone, estrogen, testosterone, and DHEA. And then I calculate the progesterone to estrogen ratio, and that gives me an exact idea of what is needed to get results really fast for symptoms, but also a long-term health plan, so that over the course of 3 to 6 months, you know exactly what you need to do in order to resolve whatever symptoms are going on with your adrenals and hormones.
Okay. I'm going to ask you one more question about adrenals, I asked somebody this at my last summit, but I want to hear what you say. I'm a coffee addict, right? And I wake up and I have a whole pot. Before I eat, it's just black. It has no milk, no nothing, just black coffee. How bad is that for your adrenals?
Well, we all are imperfect, and we all have imperfect diets, and we live in an imperfect world, and you have to learn how to live within that environment. And yes, coffee taxes the adrenals, and I'm sure you know that, and many
Oh,
of
I
us do
do. I
know
just am
the
not
things that we're
willing to
doing that
stop
are,
drinking it. Yeah.
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 So my suggestion usually in that instance is, it depends, first of all, it depends on how badly you're suffering. If you've got a lot of adrenal fatigue symptoms, I'd probably say maybe coffee is holding you back. Okay.
Mhm.
However, the thing is if you ate a perfect diet, maybe you wouldn't need to supplement anything, like nutritionally. None of us eat a perfect diet. So all of us need to supplement something. We all at least need to be taking vitamin D, right?
Yeah, definitely,
So
especially here in the UK.
yes.
Yeah.
So I would say to you that as long as you're taking an adrenal adaptogen and healing and, repair type of product, then I think that there's not really a problem about the coffee. But again, it just depends on where you're at with adrenal fatigue. If you were in stage 3 or 4 out of 4 stages possible of adrenal fatigue, I'd probably say that coffee you're going to be stuck for a while. Once you repair the adrenals and your adrenals are functioning at least moderately well, coffee is fine. I think that maybe there's a reason why you need the coffee. It's
No, I
not so
just
much as
I enjoy it. I journal and I drink it slowly and I really enjoy it. It's not to wake up at all. So I could
okay.
almost maybe change it to decaf or something. I guess I, figured out my
It's the
own
caffeine
solution.
that taxes the adrenals. So yeah, I mean, at least try half decaf and see how it goes.
Yeah,
But yeah,
yeah.
you need to take something to help the adrenal stress response. They're called HPA adaptogens, and that's hypothalamic pituitary adrenal. That's your adrenal stress response. And they're herbs that are adaptogens. They help
Is
your
that
body
like
adapt to stress.
ashwagandha?
Ashwagandha is one of them. Yep,
Yep. And can you take ashwagandha if you're taking HRT? Can you mix?
absolutely.
Okay.
Absolutely.
I think
Yes.
that's important for women to know because if you're taking, like I've never taken medicine, I never did birth control pills, but I felt so bad in menopause, of just perimenopause, that I was like, no, I'm ready to try it. And I've got like ashwagandha in my cabinet and I know it's supposed to help you sleep, but I look at it and think, I'm on HRT. Can I mix that with HRT? So these are kind of things that, women probably would benefit from talking to you about.
Yeah, and ashwagandha is not specific for sleep. It just helps the adrenal stress response. And when I look at adrenal health, I look at your AM and PM cortisol and melatonin because that's your sleep wake cycle. So it's going to be how well you sleep at night and how much energy you have during the day and how well you can deal with stress as it comes your way. So if you're not dealing with stress, you're feeling overwhelmed, you're kind of shutting down and you feel exhausted, your cortisol and melatonin graphs. So your cortisol should be high in the morning so you can get up out of bed and feel like you can handle the stress of the day. And your melatonin should be low so you're not feeling tired and sleepy. And then at night, your cortisol should be low enough so that you can sleep, not go fight the bear. And your melatonin should be high so that you feel like you can fall asleep and stay asleep through the night.
Okay.
That's an inverse graph. So it's an inverse graph, and I look at that graph because that's going to tell me like how well you're managing stress. And a lot of the time, it's either the opposite of where it should be, or flatlining, or something like that. Ashwagandha helps helps your body make cortisol it's like a modulating function. So it helps your body make cortisol in the right amounts. And over time with using it, it can help balance out that graph to be normal. I'd probably say you wouldn't be able to get your melatonin levels up without taking melatonin. So if you have any issues with sleep and melatonin, maybe you tried melatonin and it didn't work. That's only because it's one of those things that I often see as deficient. And over time, you have to be taking it steadily over time. It's not just a one-off type thing necessarily. So you have to take it over time, replenish your melatonin levels, then support that stress response system to keep your melatonin levels where they should be. And by the way, melatonin is neuroprotective. It's protective against breast cancer. So see how these hormonal imbalances are really causing increased risk of cancers in women. And it's something that you can actually control.
Can you buy that at the pharmacy in the USA? Because I know you can't here. You get,
Absolutely.
wow, that's amazing.
Yeah.
I wonder why it's not, why we can't get it here.
Probably because it is a hormone, and maybe there are issues here with people taking supplements willy nilly and not knowing what they're doing, and they think because it's natural that they can take as much as they want, or maybe it's can interact with medications, things like that, and they don't know what they're doing. That's why it's really important, if you do live in the United States, naturopathic physicians. If you can find a naturopathic doctor in your area that's a licensed naturopathic physician, that really is, and we're trained in primary care. So, we're well trained with we can do prescriptions, but also oftentimes we don't need prescriptions because we have so many tools at our disposal to be able to help, supplements, nutrition, lifestyle things that are pretty simple things that really actually improve your health. So that's our first, primary go-to.
Okay. Is a naturopathic physician the same as a functional medicine practitioner? Is that the same thing or is it different? Do you
Not
know?
the same thing at all. Yeah. Functional medicine is kind of like our new wave of, typically they're MD medical doctors. So they had standard medical training. And then they did I think it takes a couple of years to do like a certificate of kind of natural modalities, and oftentimes even looking at things on a deeper level as far as diagnosis, which is great. So it's kind of a stepping stone towards a better type of medicine.
Okay.
And I have a lot of respect for functional medicine doctors. Naturopathic physicians, though, are much different because we have a much, I don't want to say one's better than the other at all, because I think whatever suits you as a person, whatever you are most comfortable with. Functional medicine are kind of like integrative medicine doctors, where they don't have a real as deep of a training on chronic disease, but they know enough to help a lot of people. Okay. But naturopathic physicians are probably they're the highest trained in the world on natural medicines, but also chronic disease reversal. Okay. So, those with functional medicine doctors, it's like you get a little of the conventional medicine and some of the kind of root cause type medicine. So I think it's a step in the right direction for sure. Yeah, I don't
I've
know what
just
else to say
never
about that, but I
known
think,
what they were in terms of how they're different. How is a naturopathic physician different than a functional medicine doctor or functional medicine practitioner? Because I hear so many people that are going into that field.
yeah.
So that's good. Thanks for clarifying.
Yeah, I hope that clarified a little bit.
Yeah, yeah. And in terms of your program, Iris, like I understand what you do with the urine and the saliva test to help women with hormones, but what else do you have a nutrition program, or is it a program, or do you work one-on-one with clients? Tell us a little bit about how you work.
I do provide a one-on-one visit that is complimentary to women. So that is something that I like to meet people first, meet women to make sure we're a good fit. And then if I think that I can help them, then I'm able to kind of present what I feel would be the right path. I have a couple of different programs that I do work with women on. This is the only way I can really help is by kind of committing to a certain timeline. And so it's a comprehensive approach. Usually it's 6 months or 12 months. And I'm able to work with them on a one-on-one basis during that time, as well as provide an unlimited amount of kind of support and guidance. And I have another physician that works with me. And the two of us provide all of the care, and it's just a much better way to access, women's health expertise and really get results. Because as a lot of women, I know that a lot of women, almost every woman I've spoken to says, that they went to their doctor and they said everything was normal. They did testing, or even the test of their hormones, they said everything was normal. So I'm trying to help women find a way out of that, really be able to truly improve their health, decrease risk of cancer, have more energy, and just make a bigger impact in the world. And so that is best done through this program that I've developed over the last 15 years.
Okay. And do you see do you call them patients or do you call them clients?
So I call them clients nationwide, but I am a licensed physician in Washington State, and I will be also in Arizona soon. And so there I have a broader scope, but when I'm seeing women all over the country, it's more of a client type relationship. So I'm consulting and making recommendations, but I'm not prescribing, and I'm not diagnosing and treating any disease that's recognized in conventional medicine.
Okay. So no prescribing at all. Everything is something that you can get over the counter.
Yeah.
That's amazing. That's so amazing that that you have enough tools in your box to help people naturally with,
Yes. And
yeah.
nutrition, by the way, is a big part of my practice.
Okay.
And there is an opportunity to have incorporated into your comprehensive plan a full nutritional aspect for those who want it. So it's something that I think is important to understand, that we all have a unique kind of blueprint of nutrients that are required based on symptoms, based on what our lab tests show, and based on our genetics, based on lifestyle, all these things. So customizing a nutrition plan. I'm an expert in therapeutic diets, and that is definitely something that we need a lot of help with.
Okay. And like when you work with people, the 6 or the 12 months, is that online or is that in person, or does it depend, or how do you work with people?
That is, so it's 100% virtual, and I have an online digital health guidance system that they get enrolled into, that they can download as an app on their phone or log into from their desktop. And we do office hours through there. We do one-on-one video consults. We do private messaging. So they have 24/7 access to this, and as well as to private messaging with us, directly with us. So it's all virtual, and then we're able to mail. We have our proprietary salivary adrenal and hormone test kits that we ship directly to the clients, and then they're able to collect their saliva on their own at home, and then just send it off to the lab, and then when we get the results, we're able to set up the visits with them and make the comprehensive plan.
Okay. And so for now, your clients would be mostly in the USA. You wouldn't post those overseas, or do you?
There are some obstacles for women who are overseas. So right now we are focused on US clients, US women in the US. Yeah.
Okay, fantastic. And well, you've got a free gift. Tell us about your free gift.
Yeah. So the free gift is the Reclaim Your Energy Empowerment Session. So it's really meant to help you get to the bottom of why you're so tired, get clear on what having more energy would do for you, and go over a comprehensive 6 or 12-month plan that would get you there. So if you've been struggling with fatigue, or actually any of the other things that I've talked about, like anxiety or depression or foggy brain, low libido, just feeling stuck, feeling overwhelmed, which a lot of us are, because I think stress has been really, really high over the last couple of years. So if that's, kind of creating a big obstacle or a challenge for you, and you're really struggling with that, then I think the free empowerment session is for you.
Could be really helpful. And are you on social media? Like, for
Yes.
people wanted to follow you, or where
Dr.
can they
Iris
find you?
Crawford, Dr. Iris Crawford, DR, on Instagram would be the best place.
Okay, fantastic. Well, I'll share your link for your free guide. And if anybody wants to get in touch with you, I know we have a lot of people watching from the States. And in fact, I've got a few clients that are close to where you live. So hopefully some people will get in touch. And thanks so much for sharing what you shared today.
Absolutely. I hope it helps you and anyone watching. And I'd love to meet with you and see what we could do to get you feeling better.
Fantastic. Thank you very much.
Thanks so much for having me.
Okay, bye-bye.
Telling me to dance, taking a chance.